We've all heard of women's intuition, right? Well, men have intuition as well. Intuition is so important when it comes to feeding ourselves and our families in our challenging food environment. This podcast explores a variety of topics related to a powerful, evidence-based eating framework called intuitive eating that integrates instinct, emotion, and rational thought. My hope is that it will help you finally break free of the perpetual diet cycle. This is the Men's Intuition Podcast. All right, and welcome back to another episode of the Men's Intuition Podcast. Today, I have another very special guest. Danielle Bubliz is a registered dietitian, nutritionist, and certified intuitive eating counselor. She specializes in working with people with diabetes and binge eating through a health at every size aligned lens. Danielle earned her bachelor's degree in nutrition and dietetics from California State University at Chico and received her master's degree from California State University at Northridge while completing the dietetic internship program. Danielle is passionate about guiding her clients with diabetes toward feeling much more at peace with their food decisions, blood sugar management, as well as making peace with their bodies. So without any further ado, welcome.
Thank you so much for having me, Jeff. I'm excited to be here.
Yeah, I've as I told you kind of when we were chatting a little bit before we started recording, I've had you on my radar since day one when I came across your work, and knowing that at some point I wanted to have you on the podcast because this is such an important topic that we're going to be talking about today: diabetes and prediabetes and blood sugar management in the context of a weight neutral approach. Since so much of what we hear is just very weight centered in managing these things, so.
Oh my gosh, absolutely. And I'm super honored that you reached out too, because I love talking about this. This topic is very near and dear to my heart. So I'm excited to get to chat more about it.
Yeah, well, that's great. Well, why don't you start off by just telling us a little bit about yourself, the work you do, and kind of why you chose to specialize in not only a non-diet intuitive eating approach, but specifically like diabetes and that kind of thing.
Yeah, I mean, so you already kind of gave the introduction around my education. So I'm a dietitian and also a certified intuitive eating counselor. But the reason I went into this space, this niche of diabetes and intuitive eating in this like health at every size lens is because when I was 16, I was diagnosed with type 1 diabetes. And this was a total shock to my entire family because nobody else had it. My endocrinologist suspects, because I had a pretty bad flu, that I had like an autoimmune response. Like this was like a flu that lasted like a month. It was pretty bad. So shortly after that, I started having all those signs of diabetes, extreme thirst, going to the bathroom a lot, all that. And fortunately at the time, my stepmom was an ICU nurse. And so she's like watching me like something's going on here. And she was able to get a glucose meter and she had me fast overnight and checked my fasting blood sugars, and my fasting blood sugars were running at 500.
Oh, wow.
So yeah. So I was really fortunate because I know a lot of people's diagnosis stories end up in the hospital. So that was caught earlier for me. And I think through the process of being diagnosed, trying to learn what it even means to take care of myself, it was hard and also eye-opening. Because honestly, my perspective around diabetes, I would say it was like kind of that stigmatizing view that's like, oh, sugar causes diabetes, or if you're at a higher weight, this is what happens. And so I was like, my eyes were being open to how complex diabetes really was. And prior to my diagnosis, I was already struggling with binge eating. So that was its whole other issue with food. Anyways, when I was in my undergrad, there was a course I took where the teacher had us read intuitive eating. And I remember,
that's surprising.
I know everyone says that when I talk to people, they're like, that's lucky. We even had a health at every size group on campus, which I joined.
Wow.
Totally different. Yeah. But I remember going home and reading the book because it was my homework assignment, but kind of like identifying like, oh, this is like really hitting home for me. Like there's a lot of things, that I can resonate with and I know I struggle with. So I was fascinated with it and I was trying to digest, what it means to actually let go of food rules and have diabetes, which still didn't quite feel like it would work. But,
Yeah.
because when you have like a medical condition, making peace with food feels like it's not meant for you. It feels like, oh, okay, well, you can kind of have permission here, but not really. Like, let's
Hmm.
portion it. So, as I worked and became a dietitian and I started working with people, I went to a private practice where I focused on eating disorders. And this is where I really started seeing the issue when I was getting people with type 2, type 1, with eating disorders. And I was hearing the same messages of, I'm trying my best to nourish my body, but I'm so afraid of carbs, but I'm
Hmm.
so afraid of these foods. And I could totally connect with that because every appointment I went to, I was getting advice on weight loss. I was getting advice on cutting foods out. So that's where I started forming this like, you know what? I want to help people with all forms of diabetes reduce shame and learn how they can manage their blood sugars without having this kind of like modified permission. So that's why
Yeah.
I do what I do.
Well, that makes a lot of sense because having that lived experience really, really helps. Because I know I find it challenging when I'm talking with clients about different conditions that they have, whether it's
Totally.
diabetes or something else, and from the perspective of theoretical knowledge, my
Yeah.
understanding of the process and sort of trying to help them uh, navigate that. But yet, I've never had to deal with that. I've never had the fear that carbs are going to impact my blood sugar, or that some people are probably even to the point where they're fearful they might die or have a very
Mhm,
serious
mhm.
complication.
Oh,
And I
yes.
know that from a lot of the reading I've done in this area and the research that a lot of people have. Um, it's not uncommon to have disordered eating along with a diagnosis like this because it just naturally seems to drive you toward those attitudes of restriction, and then which of course we know
Absolutely.
leads to binges
Mhm,
and
mhm.
even though we know something's not good for us, it doesn't mean that we will stay away from doing that. So we know all of those kinds of things, and so yeah, it's great to have people like you who do have that lived experience and are
Yeah.
coming at it from that place
It is
perspective.
a yeah, it is a really, interesting space to be in, and I can totally relate to, working clinically and seeing people with all different types of conditions. It's like, we can always offer a lot of empathy, we can always
Hmm.
offer a lot of support, but, yeah, like, understanding what it feels like to have to prick your finger every day, to go to that endocrinologist office. I do feel like this is, like, something that I just heavily resonate with all of my clients, even when we've had totally different lived experiences. So, yeah, it's very challenging, and I think, what I am continuing to learn about the diabetes realm is just how fat phobic it is, and,
Hmm.
just how complicated it is to get a diagnosis and right off the bat be told all the complications and be told, you got to be perfect. You got to do it's like, I don't even know what I'm doing right now. This whole diagnosis is turning my brain upside down. So, yeah, it's hard.
Yeah. Yeah, I can imagine. Well, yeah, within that weight-centered healthcare system that you kind of alluded to there, it's not uncommon for doctors to just immediately point to body size
Mhm.
as something that needs to be treated. That seems to be the immediate go-to in a lot
Oh,
of
yeah.
cases. It's
Yeah.
easy, doesn't require a lot of thought. It's sort of
Mhm.
that,
Mhm.
oh, I can just point them there and then send them on their way. And I'm not trying to say doctors don't care, because I know they do, and they're in many cases hamstrung by our medical care system and the way it works, having to
Mhm.
see so many patients in order just to meet a
Yeah.
quota or
Ugh.
make a living.
Mhm.
But especially in the context of prediabetes and type 2 diabetes, I guess this is probably quite common. Um,
Totally.
it's often used to
Yes.
explain why a person's having issues, or maybe as a
Yes.
warning for what could
Yep.
potentially happen. Is this what you see with your clients also?
Oh, yes. There is so much shame. When I work with individuals that are in larger bodies and they get diagnosed with diabetes, they instantly feel like it was their fault. They could
Mhm.
have done better. They could have tried harder. There's just this thought of like, I messed up. And I don't want to like jump ahead, but when it comes to like what causes diabetes, we
Mhm.
still don't have a for sure because there are so many factors at play. There Something to know is that it's never caused by one specific thing. It's
Mhm.
many factors and it can range. I think there was even like a recent New York Times article talking about trauma and how trauma can have a huge impact on the development of diabetes. Weight cycling, food insecurity, race, ethnicity,
Mhm.
family history, genetics, having comorbidities like polycystic ovarian syndrome for
Mhm.
women. They find that insulin resistance. So as you can see, it's like somebody gets a diagnosis and they assume it's their fault, but there are many things to consider and to understand that were really not
Right.
in their control at all.
Yeah. Well, and even if in a particular case, the amount of body fat and the distribution of that body fat that the
Mhm.
person has, even if that is a contributing factor, it's not helpful to say, "Oh, well, look what you did," because how we carry our
Mhm.
body fat is
Mhm.
very genetic, and how we accumulated it in the
Yes.
first place
Mhm.
is such a complex issue too. I mean, even people that are very weight centered are starting to acknowledge more and more that it's not a simple matter of, "Oh, well, this person hasn't been eating right or this person's lazy."
Yeah.
There's
Yeah.
there are so many factors,
Mhm.
social,
Mhm.
economic, um,
Yes.
genetic, all of those things that you talked about there.
Plethora of things. Yeah, it's so true. So, so true. And I think another thing that is always interesting to me, I've had a few conversations because I do work with people that are in recovery from eating disorders
Hmm.
and have diabetes. And when I've had conversations with them about their appointments, you know, when they got diagnosed, they'll say, like, yeah, the doctor told me to cut this out and to do these things and to exercise this amount. And I asked them, I was like, did they ask you what you do? Like, did they ask you what you're eating? And they're like, no. I'm like,
Yeah.
because if you told them, they would know that you have an eating disorder and that you're currently
Right.
not eating at all. So, and
Yeah.
you're
Or
not
the
able to do
exercise.
movement. Yeah. It's like,
Yeah.
yeah.
It's your excessive exercise and not eating, and then they're telling you to eat less and go
Mhm.
move more, and
Yeah.
yeah, and it's just exacerbating that issue that they're dealing with.
It's just very complicated. So, yeah, I do think, again, I like how you said it's like, doctors, I totally respect their profession and I know that they have so much on their plates. And I think the
Mhm.
medical system trains them up to look a
Yeah.
certain way. I mean, same with my dietetics program. Most of my dietetics program was those very generic printouts, weight loss, things like that. So it's like we were trained in that way. So it's definitely shifting that conversation and learning how to move in a direction where this weight inclusive evidence is coming out and how it can benefit blood sugars versus the latter of diets, weight cycling, things that are negatively impacting people with diabetes.
Yeah, definitely. Yeah, I'm glad that it's becoming more common. And in fact, we were talking about Dr. Gregory Dodell and
Hmm.
how
Yeah.
he's been really vocal in that area. He's an endocrinologist. I interviewed him on an episode
Oh, yeah.
a
So
while
great.
back on
Hmm.
here. So any listeners listening, go check that out too, where he talks
Yeah.
about weight neutral, weight inclusive healthcare. But yeah, it's great
Hmm.
to see that it is being talked about at least more and more publicly, and so hopefully that will have an impact in and eventually trickle down to just better overall healthcare for everyone
Absolutely.
in this
More
area
like
and any area.
patient-centered, right? Yeah.
Yeah.
Yeah. I think even just moving to more of that patient-centered approach means a lot to people. It can make a huge difference.
Yeah, it really does. Well, how does a weight inclusive, weight neutral, kind of non-diet, anti-diet, all these terms that we sometimes hear in this space, how does that approach differ? And then is it actually effective and even evidence based? Because a lot of times it can come across to those who are brand new to it as just this sort of, oh, well, I just don't like this. It doesn't feel good to me. So I'm going to do this other thing that feels good to me, makes me feel good about myself. And sometimes, I mean, is it evidence based? And that's, I guess, especially in the context of kind of addressing blood glucose and that kind of thing.
Yes. Yeah, I definitely think in this space, especially with social media, a lot of times when people hear like weight neutral or anti-diet, they kind of think it's like very extreme and things like that. But, as far as the approach that I take with my clients with a weight neutral lens is essentially, I'm not focusing on getting them to lose weight. I'm trying to focus on them promoting, using these health promoting behaviors, which consist of, making sure you're nourishing your body adequately, which is very new for a lot of people to understand, because I think our society for the longest time, like even in the 90s, it's like South Beach diet, slim fast, we've just been trained in this way that less calories is better. But I always try to explain to my clients, like, calories equals energy. If you're not getting enough energy for your body, you're not going to function very well. And it's going to be really challenging. So nourishing your body consistently, focusing on sleep. There is a lot of studies about when you're not getting the best quality sleep, it's interrupted, cortisol levels will rise, and that can cause more insulin resistance and higher blood sugars in the morning and potentially throughout the day. So sleep, we usually talk about movement, but in the sense, because I work with people in recovery, what are your intentions? What is accessible for your body? So, as far as movement, there's a lot of information and research around even just 2 minutes of walking can be beneficial for blood sugars. And just to kind of explain what happens. So when your, muscles are contracting, they are pulling glucose, and that is really helpful to bring them into the cells. So a lot of people with all forms of diabetes can get a benefit from it. And like I said, 2 minutes. It doesn't have to be 4 hours. It doesn't have to be a ton of time, just whatever is accessible for your body and you enjoy.
Yeah. Well, and even, resistance training or weightlifting, that kind of a thing is something that's extremely beneficial. And in fact, people with type 1 diabetes have to be careful that they adjust their insulin accordingly, because it can cause you to go low.
It's a learning curve for sure. I have an insulin pump, and I took at Chico, I took a weight training class, which was hilarious because my upper body strength is a little sad. But I would have to, turn off my pump, and I would have to have my snacks. So yeah, you're so right. So there's definitely a lot of benefits there. So eating consistently, sleep, movement. Also something too, and I know I'm not sure, have you finished your intuitive eating training? Okay, wonderful.
Yeah.
That's awesome. I know there's a part talking about positive relationships in your life, like social support. And there is research around that too. It's like being able to surround yourself with people that are supportive and having those positive connections mentally that benefits. So yeah, there's a lot of different ways of focusing on your health that don't have to do with restricting foods and don't have to do with trying to get to a certain weight, because that part can be stressful on the body and the mind.
Yeah, the things that you have so much more control over, like you have in again, this depending on your ability and your access, but most people have the ability to go do more, move around more. And so if you're not moving at all, you can move some. And as you were pointing out, it doesn't take a lot. And even the research that's coming out, a lot of research coming out now is pointing to the fact that you can see the bulk of the benefits with relatively small amounts of changes. And it doesn't take, I kind of mentioned resistance training as being helpful, but you don't even have to do that to get the bulk of the benefit. Just moving, like you were saying, moving around more gets you that. It's that low hanging fruit, and it's something you can do rather than hope happens to your body. Like with weight loss, you just are sort of, okay, I hope it responds like,
I hope it responds.
Like
I
think
miss
it's
bread.
like they
I
told
am
me.
sad.
Yeah. But with these things, you have
hungry.
that. You have that ability to control it to much more to a degree. And the weight training, resistance training, one day a week will give you huge benefits, and those benefits. And so you don't have to do all of these typical fitnessy kinds of things, go big or go home, or do high intensity intervals, and all of these different things that are so popular that people are always debating which is better. When in reality, just moving is going to get you the bulk of those benefits. And
yeah, it's so true. I know, because you're also a personal trainer, that you have lots of experience in this area and have probably seen kind of some of the culture around fitness. So yeah, absolutely. I think people feel so much more motivated. I have a client that I met with yesterday that told me, it's funny, she's like, you told me that 2 minutes of walking is enough for my blood sugar, so I've been doing that every day. I'm like, that's awesome, because it actually seems like reasonable to people that have different lifestyles and accessibility. So yeah, I love it.
Yeah.
It's great.
Well, I'm always telling clients when they come to me, and because I work with them with intuitive eating, but if they also want to incorporate kind of structured exercise, I can help them with that. But it's not uncommon for them to say, yeah, I think, I'm planning to work out 5 or 6 days a week. And then we talk more and I say, well, what is that really realistic? Well, I think I can do it. And it's like, well, what about, let's start with 2 or 3 days a week.
Yeah.
And, as we talk through it, they realize, I guess committing to 6 days a week is going to be really difficult. And then you start feeling the guilt and shame for not sticking to it and it's often you think that you have to do all of that to get the benefit, when in reality, it's exactly what you were saying. It just doesn't take a huge amount.
Yeah, I love that. Yes, exactly. So, those are things, as far as like working with clients with diabetes, that I definitely try to focus on. So it's more of like this holistic overview of like, what is your life looking like right now? And I always start off with people, we'll be chatting and they're telling me some of the things that are going on. And I'm like, can you just like run through a day of eating for me? And as we're going through, I'm like, where's the carbs? You need something here. Like, you're not eating enough. And they're always shocked. And I'm like, but you need more, and your brain needs more, So, I think it's what I love the most is just getting to show people that, I think our culture and society has made it seem so hard, when in reality, we can find ways to care for our blood sugars that doesn't have to feel restrictive, doesn't have to feel stressful. And it's cool because I've seen a lot of my clients, pre-diabetes, diabetes, lower their A1Cs, have more stable blood sugar readings. And it's like, what are they doing? They're eating normally. They're moving in ways they like. They're living their life with less shame. It's like, wow, can this just be the standard? Because I think a lot of people would really do so much better with just grappling with diabetes if they knew that they didn't need to feel so limited.
Yeah. Well, and it's one thing if it was easy to lose weight and keep it off, and that was a no-brainer, and that always worked if it did, but it doesn't always. And it also, it's one of these things that we just know it just is not something that happens as the norm. And so, but yet it's like telling someone, oh, well, all you have to do is take this medication for this condition you have. And they're like, well, I don't have access to that medication. Well, okay. And so now the person can't access what it is that you're telling them to do.
Yes.
And it just further perpetuates that cycle of guilt and shame and frustration and stress. And
Oh my gosh, so true. So true. Yes, very challenging. Access to care too is it's a huge part. And something I would see in the hospital a lot of times is sometimes we'd have doctors that had specific diets they loved, like the vegan diet.
Yeah.
And they would tell the patient, like, don't worry, just go vegan. And I would get a consult and I'd go up and they're like, I don't like this food. Like,
Yeah.
oh, okay, you don't need to do that. So yeah.
Yeah. Well, practically speaking, let's just assume someone is already experiencing some issues. Maybe they have prediabetes, type 2 diabetes, PCOS, as you mentioned, involves some insulin resistance and that kind of thing. How can somebody take kind of an intuitive eating approach to manage this that doesn't involve focus on intentional weight loss or restriction, like restricting carbs? Because obviously, I mean, some people do control their blood sugar by just not eating any carbs. But if that's not sustainable, then that's not going to be a good long-term solution. And it also doesn't fix the problem. It just sort of masks it. A lot of people are like, oh, I'm in remission because my numbers are, it's like, well, what happens if you eat carbs? Well, then my blood sugars go up. Well, then you're not really in remission. Your body is still not responding. So what are some practical ways that people can do this? I know diet, I know how you eat is one way, but maybe you can talk about that.
Yeah. So practically, like I would honestly say, still considering that consistency with meals. And the reason I talk about that so often, well, one, your brain needs fuel. And if you're not giving yourself the carbohydrates, which is our body's primary fuel source, although tons of people that are keto fanatics would yell at me, brain's primary fuel source, they're protein sparing. And so when you're not getting enough, your body is trying to find that source, and it can use protein and fat, but just not as efficiently. And so you might feel like brain fog, things like that. So consistent nourishment. And with that, you're not allowing, when you're having your breakfast and maybe throwing in a snack before you get to your lunch, you're allowing your blood sugar to understand, okay, I'm getting my energy and I'm working with it. When we go long periods throughout the day, it's like, okay, I've got my energy and I'm coming down, and you just start tanking. So when you get to that next meal, you're really hungry, irritable, it's hard to concentrate. So it's like eating isn't even as enjoyable as it could be because you're not even present with it. So consistent nourishment and honestly, movement that's accessible to your body. Sleep. I think it just goes right back to those health promoting behaviors because those are things that are within your control. Stress management, if possible, finding ways, like I've had clients where they wait until their head's about to hit the pillow to start writing their to-do list. It's like, we're not going to do that before we go to bed. So very simple things that are just going to help you calm your body, feed your body, and move your body. And that's about it. Yeah.
Well, now what about like meal composition? Because I know that there's some ways that you can put together your meals that don't involve restricting. It's more of a mindful, that gentle nutrition part of the equation. Maybe you can talk a little bit about what are some simple things that we can do with our meal construction that can be helpful.
Yeah, absolutely. So I always recommend when somebody's putting a plate together that you have a carb source, you have a protein, and you have a fat. And if possible, throw in a fiber like a veggie. And the reason why that composition can be so helpful for like delaying blood sugar spikes and like blood sugar regulation is because usually when you're eating these foods, the protein, fat, and fiber slow down the carb breakdown. So when you eat a carb on its own, there's nothing wrong with that. The carb is meant to give you energy. And like I said, primary fuel source. But when you pair it with that protein, fat, and fiber, it's going to slow its breakdown. So rather than eating a carb and your body's like, here's my energy, you eat the meal and it's slowly going up. And that will physically feel a lot better, because you'll have a lot more stable energy. So I find that it's really helpful for people with diabetes, but also just like anyone,
Yeah.
because it's satisfying. Like a lot of times people will up the protein, but they're not adding a fat source. And the fat source brings the satisfaction and, adds that like beautiful taste. So, or like the fiber component. I think a lot of people eat salads without dressing or eat salads without like the fat source. And it's just like, it's not enjoyable. I think people don't like veggies because they don't season or flavor them in a way that's enjoyable. So, yeah.
Yeah, exactly. There's nothing worse than a vegetable without any kind of seasoning for the most part. You need something, just a little bit on there.
You wonder why the salads at restaurants are so delicious? Because they have croutons and cheese and a dressing. It's like, that's what makes it delicious. And fun fact too, with seasoning your veggies in a way that tastes amazing, most vegetables have fat soluble vitamins that will not absorb without a fat source. So I just tell people, get that dressing on there, get the cheese, like you need it and you're going to love it. So do it.
Yeah, that's a really good point. And one of the things I love with that advice is that it is really, it's easy to do and without overthinking it, without restricting, without putting foods into good, bad categories. I mean, they're categorized as far as, hey, this one's got a good source of protein, this has some fat, but it's relatively easy to apply that to any meal. And, and often you can even if you just sit down to a meal and you didn't have that planned out ahead of time, you can still make an adjustment kind of on the fly. I do this all the time with my wife. She'll make something and I'm like, there's not enough carbs in this for me. So I'll add in some garlic bread or just a piece of toast or, something to it just to add in the additional carbs.
Mm-hmm.
Yeah.
Mm-hmm. Yeah.
Definitely.
Both my husband and I are very much that way too, where I'm like, I want a little extra of this. And he's like, I want a little extra of that. And so, you just amp it up to be that, that flavor and that texture that you want. So, I think that was something that also really surprised a lot of clients that I've worked with, to share. It's like, a lot of times people think, okay, I've got the salad. I'm being really good. I didn't do the toppings. It's like, well, I think you should do the toppings.
Yeah. Well, and the salad doesn't have a lot of energy in it. There's not much energy density. There aren't many carbs in there. Maybe you get a few carrots here or there or tomatoes, and that gives you a little bit, but it doesn't give you the energy that the diet culture would tell you about carrots and the sugar. And that's another topic. But
I know. Yeah. So that's kind of like the composition I do like to chat about with people. So the carb, protein, fat, and fiber. Emphasis on don't skimp out on the fat, because I see a lot of information on just carb and protein. And I think the fat part is important too. So, yeah.
Well, I like that little geeky part you dropped in there about the fat soluble vitamins, because that's again, that's that general nutrition that we can bring in and our understanding of how the body works. Vitamin D is one of those fat soluble vitamins and
vitamin A
and K and without the fat, then our body doesn't absorb them, so we're not going to benefit from all that great stuff in the salad.
Exactly. Yeah. So that's one of my favorite little tidbits, geeky fact about salads and veggies.
Yeah. Well, do you have any recommendations, kind of while we're on this topic, for parents when talking about these things with their kids and their teens, maybe about their diabetes? Do you recommend that they are open about their condition with the kids in general, or is it a kind of as needed basis? What are your thoughts on that?
It's pretty challenging, I will say, because you think about being in that parent situation where obviously you care about your kids and you want the best for them and you don't want to see harm come their way. But I think what would be most helpful is trying to refrain from certain terms, like refraining from saying the junk food, the good food, the bad food, because kids really do absorb this and they're watching you too. I think this is just another challenging part is that kids are always watching their parents. I was watching my parents, with all those crazy 90s diets, and it's like we receive the message around what we should be ashamed to eat and what is okay. And so for parents, it's pretty challenging, but I would say if your child has diabetes, I think the best thing you can do is really help them understand that no food has to be off limit. We really just want to be able to understand like that composition. Can we create a meal that is going to be satisfying to them? And can we look at foods in a more neutral way, because food doesn't have moral value. And I work with a lot of clients with type 1 that still call foods like, oh, well, I eat the junk food. And I'm like, you eat potato chips. That's it.
Yeah.
They're just chips, It's like it's a carb source. So yeah, just really trying to bring that language back to a neutral ground is helpful. And then maybe even just how you're putting your plate together, just recognizing that your kids are watching that. Does that answer that question?
Yeah.
Okay.
Yeah, I think that's great advice. Is that generally modeling it rather than and rather than going too much into the specifics of the details of it. If you just model it, especially when they're younger, then they can just sort of adopt that as a normal habit, normal way of putting together a meal.
Yeah, and I love, there's a couple accounts that I follow. One is Nicole Cruz that works with a lot of parents and children. And I love how she's always saying like, the dessert doesn't have to come after the meal. Like you could put the dessert on the plate. It's like this idea that it's like you don't have to earn the food. And I never really thought about it like that. Like, oh, I guess as like a kid, you can't leave the table until you finish your peas or your carrots. And yeah, I guess, as like kids, we do absorb that info and kind of model that later in life.
Yeah, that's true. And my nephews are both, they're 5 and almost 2. And I love watching them because my sister-in-law uses that approach. And so, so when we're eating together, their plates are full of desserts and vegetables and everything. And sometimes they take one bite of the dessert, or it's because it's so normalized that it's just food that it's really cool to see that. And I remember having a client one time, she sent me a picture of her son with a broccoli in one hand and a brownie in the other. And he was going back and forth between the two.
Wow.
And it was just, it
what
was just really cool to see that kind of, that just normalization of food. It's like, sometimes I like a bite of brownie and sometimes I like a bite of broccoli. And
love
and
that.
just helps
it's
sort
so
of
different.
neutralize it.
It's so different, but like makes a lot of sense. So I think those are really cool things to think about when it comes to parenting and, a kid that has diabetes or doesn't have diabetes. I feel like it's the same. It's really just modeling that normalization of food.
Yeah, that's great. Well, let's shift gears a little bit. This one is going to take us kind of to the last topic. And this one's kind of a controversial one and one that's getting more and more talked about lately. And so I'd love to know your thoughts on some of the drugs like semaglutide and the newest one, tirzepatide or Mounjaro. Semaglutide is Ozempic and some of those other ones that were originally developed for managing type 2 diabetes. And we won't go into details of, maybe I'll get Dr. Greg Dodell to come on again or something to talk about those. But
he'd be great to talk about that for sure. Yes. So this has definitely come up a lot, especially with recent articles about celebrities using Ozempic for weight loss purposes, not for diabetes. I think it's brought a lot of attention. And so when we think about, like Ozempic or Mounjaro, they're really meant to be a regulation for blood sugar. That was its intended purpose. There are side effects that are pretty well known of like nausea, vomiting, all the fun side effects that they throw out in those commercials, like really fast. As well as some, like early satiety that can happen. And again, usually that early satiety, it happens when you're at like a higher dose, but I feel like research has held on to this, like, finally, now people can make the best choice because they're not hungry. And it's like, hold on, we really got to assess, this medication has been shown to be helpful for blood sugar regulation, and there's this side effect. So to kind of explain more, I think when it comes to people with diabetes trying to access this type of medication, yes, it's being promoted for weight loss, but even with Dr. Dodell, I remember him and I chatting about it. He's like, it is a really effective blood sugar regulation, drug.
Yeah.
And that's what it was meant for. But we have to understand the person that's getting prescribed this, because this would not be a helpful medication for somebody newly in eating disorder recovery or currently working in like a treatment, like being in a treatment center, because that early satiety can be very triggering. So whether you have diabetes or not, that's something to consider, is like how it could impact that relationship with food. It's pretty immense. And I'll have to send it to you after, but I had come across this article, and it was a person that had been on Ozempic for a while, and she was saying, like, my relationship with food changed, and in a negative way, where it's like the enjoyment of food was gone, things like that. So I digress. Sorry, I could go on a rant about this.
No,
but
that's important, though. Yeah, I mean, it's important to understand those, because most of what we're hearing are oh my gosh, this is amazing. I don't crave alcohol anymore. I don't crave these sweets anymore, and my appetite it's non-existent, and it's almost seen as like this magical, positive in almost all cases, and in some cases that could be beneficial, but like you're saying, it depends on the individual. Somebody in eating disorder recovery who has no connection with their appetite regulation system, making it worse
dangerous.
That could really be an issue.
Yes. And I worked with a client that was in eating disorder recovery that she was pretty far along in eating disorder recovery and was put on Ozempic. And I remember her and I chatting often, and I was like, okay, well, we really got to make sure that this consistent eating is still happening, that we're getting our snacks in, that, we're throwing in a supplement shake if you're feeling like that appetite is not where you want it to be, as far as able to finish a meal. So there's a lot of challenges with having that early satiety. So very dependent on the individual. I would say, yes, it is super helpful for blood sugar regulation. And it's a little bit unfortunate that this has become so popular with celebrities, because there's a shortage for people that need Ozempic right now. And a ton of my clients have been talking about this, like, this is something I've used for a long time. And now I can't fill my prescription, and I'm switching to Trulicity. I'm switching to like another one, and now I'm going through new side effects. It's just, it's a lot. It's a lot.
Yeah. Well, and I was thinking about this particular issue, and I think when we talk about some of the downsides of intentional weight loss and dieting and intentionally eating in a calorie deficit, you get those negative side effects of that by lower energy levels and maybe sex hormone production. So those things, your sex drive can decrease when you're dieting for a long period of time, and all of these other things, and hunger and increased hunger drive is one of the side effects. But when you have a medication that takes away that side effect, I was thinking how it would be very easy to think, well, I'm not hungry anymore. Yay, this is awesome. But you still have the other issues because those drugs don't negate those other side effects of being underfueled when you're if you're intentionally trying to lose weight. And in many cases, I heard one doctor talking about tirzepatide as an example being almost equivalent to the outcomes that they're seeing with weight loss surgery, as far as like 25-30+% body fat reduction from taking this medication because of the appetite, the tank on your appetite. And I just think, if it would be really easy to get caught up in that. And so, with your patients that are taking it, how do you incorporate intuitive eating? Because I still think we can incorporate those principles, but maybe we have to shift where we focus, like which principles we focus on more. Have you found that to be the case? I don't have a whole lot of patients with it. And so, I just have a couple, and it hasn't really like tanked their appetite. So it's not a huge deal.
I think it's the dose that can really impact that too. And I just want to throw out something too with like Mounjaro. It's like there isn't that much research out like long-term wise.
Right. It's still a new one. Yeah.
It's still pretty new. And I feel like we always, those randomized control trials, we always need to understand like those long-term, what's the long-term benefit? And it kind of goes back to the diet cycle. It's like we haven't been able to find any diet that has helped with long-term weight loss. So, when it comes to like these medications, I don't have very many people. I maybe only have a few that are Mounjaro, and then I have quite a few that are on Ozempic. And I think what we really try to focus on the most with like the principles is those food rules. And we really try, it's kind of hard, it's like honor your hunger and your fullness, but the fullness is being affected. So I do try to just, how do we keep that consistency with meals coming through? And there are some other ways to identify fullness and hunger. So we discussed that. It's very dependent on the person. But I think it ends up being a lot more about, how do we not create more rules around food? How do we keep that permission there? So trying to keep that part very flexible, because I'm not going to deny someone that feels super nauseous. Like that's really hard. And we still need to make sure your body's getting enough food. So it's challenging.
Well, I guess you'd probably apply some of the principles you would for people going through other kinds of medical issues, whether it's cancer or IBS or other digestive issues and those kinds of things. And so that practical hunger part where you're
absolutely
thinking more in terms of those things or applying that more often than you might in another person.
Absolutely. Yes. That's a practical hunger. Yeah. I would say that's definitely where we kind of focus on because speaking of like digestive issues, people that are in eating disorder recovery or people that don't eat enough and they're dieting a lot of those like GI issues tend to come from not getting enough food. So so definitely trying to make sure that we can keep that pattern of eating going for sure is very helpful.
Well, what's interesting too is when you think about these medications, if you're experiencing the same kind of weight loss that someone in an eating disorder might experience, these don't protect you from those digestive issues, from gastroparesis developing, from developing gallstones, from those are common side effects of dramatic weight loss and those kinds of things. And you would see that the drugs don't protect you from that. And so again, just another thing to keep in mind if it's something that someone's considering, apart from treating diabetes.
Absolutely. And if I could just quickly, like briefly just talk about the bariatric surgery and diabetes kind of
definitely
situation, I know that tends to be something that a lot of people with like type 2, they get prescribed like, oh, just get weight loss surgery and your diabetes will go away or your blood sugars will be fine. And I always try to discuss with clients that have been getting this message consistently, that research is also very biased, not a lot of long-term results for better blood sugar control. In fact, a lot of people that go through bariatric surgery, which is essentially an amputation of part of your stomach, have a lot of difficulties with nutrient deficiencies, malnutrition, eating disorder development. If they had an eating disorder before, it gets exacerbated. There's just so many issues, and that stress on the body going to bring that blood sugar right back up. So I say it like, take your time to think about what you think is best, but I want to bring this more long-term, what has research shown, because I know when you go to those doctor's offices, you're getting a quick spiel and all the bells and whistles. But the reality is, and when I work in the hospital, I see tons of people readmits in the hospital. They have malnutrition, lots of nutrient deficiencies. They're barely eating. It's like, it's not as glamorous as it's being made out to be. So just being really mindful that there is a lot more to understand when it comes to Ozempic, to Mounjaro, to bariatric surgery. And while, yes, those medications can be helpful for blood sugar regulation, we just really have to understand the individual and where they're at.
Yeah. Yeah. I think that's so important. All of that stuff that you said is really important to consider. It's not that we're dissuading anybody from taking an approach, because obviously those would be medical decisions between a person and a doctor. But at the same time, understanding that I think one of the things that so often happens, and you see it in the fitness spaces all the time too, is people are excited and vocal when something works. Yes. So you hear this with keto proponents. They just are like, oh my gosh, I've been keto for 10 years and I don't crave sugar and blah, blah, blah. And then you don't hear the people who tried keto for 6 months and it, quote, worked for them for 6 months, but then they just couldn't take it anymore. And so they quit. They just suddenly go silent, because I think there's this guilt and this shame of when something works. For me. I didn't do it's like, oh my gosh, look what I did. And if it doesn't work, then there's that guilt, the shame where it's, I don't want anybody to know that it didn't. So we tend to get, I think, a skewed perspective on how great certain things are versus the downsides and the negative consequences. You know, you don't hear about the person who lost all this weight on semaglutide and then couldn't afford the $1,000 a month because insurance still won't pay for it for weight loss in most cases. And then they realize, well, I can't sustain this. And then the weight comes back on. And that, I mean, even the most ardent proponents of it know that when you stop, the weight tends to just come right back on again, even if you're using it for weight loss. And so all of these negative things, I think it's important that people have a true understanding of what they're looking at before making these decisions.
Absolutely. Just have like a full picture of it. You know, like you said, it's like, rather than being zoomed in on somebody's success story, quote unquote success, because we really don't know what's happening. It's like looking at the bigger picture. And so, you know, this is not to shame anyone that has felt like these are decisions they want, but it's more so like, just understand that there's two sides of the coin, and be able to weigh out what is most important to you. And yeah.
Well, I think that's a great place to wrap it up. So why don't you tell people how they can connect with you, follow your content, even work with you directly? Maybe you can let people know, because I know I certainly don't treat diabetes or work with people to the extent that you would. So I would definitely refer someone out if it was more of trying to manage that. But how can people get in contact with you?
Yeah, so I'm mostly on like Instagram at Food Freedom Diabetes, and my main website is foodfreedomdiabetes.com. So pretty simple, Food Freedom Diabetes.
I'll include links in the notes for that.
Perfect. And then, if you want to work with me, I have a program. It's kind of like a hybrid program where I do work with people with all forms of diabetes to help you practice intuitive eating, reduce shame, and get your blood sugars to a place where it is manageable and you can see that progress with your A1C without any of that diet crap. Sorry.
Oh, yeah.
Crap.
That's great. Yes. All right. Well, that sounds great. And I just want to thank you so much for coming on here and sharing your wisdom, your insight, your expertise. And I look forward to staying in contact over social media, and maybe have you on again on the show down the road.
Oh my gosh. Yeah, this was great. Thank you so much, Jeff. I'm so glad that we could connect because we're very like-minded. So I would love to chat with you again. Maybe we can go on an Instagram live at some point. So
that would be fun. Yeah.
Yeah. So
Sounds
super great
great.
to chat with you today.